Endotracheal suctioning in critically ill adults. This is an instructional video meant as a companion piece to the Simplified task analysis produced by Reddy and colleagues. The Simplified task analysis can be found by following the reference below. Begin by performing basic hand hygiene. First, remove rings and watches. Apply antibacterial soap to a cupped hand. This can also be done with alcohol-based hand rub. Rub hands palm to palm. Rub palm to palm with fingers interlaced. Rub right palm over left dorsum with fingers interlaced and vice versa. Rub backs of fingers to opposing palms with fingers interlocked. Rotational rubbing with clasped fingers of right hand in left palm and vice versa. Rotational rubbing of left thumb clasped in right palm and vice versa. Rub both wrists. Dry hands with a non-sterile towel. Once hand hygiene is complete, prepare the patient for suctioning. If not already connected, connect a pulse oximeter. Always hyperoxygenate the patient before suctioning. Hyperoxygenation can be accomplished by manually ventilating the patient with 100% oxygen, or by increasing the fraction of inspired oxygen on the ventilator to 100%. Optionally hyperventilate or hyperinflate the patient's lungs. Hyperventilation can be accomplished by manually delivering an increased respiratory rate with the manual breathing circuit or temporarily increasing the respiratory rate on the ventilator. Hyperinflation can be accomplished by manually delivering large tidal volume breaths, temporarily increasing the tidal volume on the mechanical ventilator, or electronically delivering pre-configured sigh breaths on a mechanical ventilator that has this function. Optionally perform tracheobronchial lavage by instilling sterile normal saline down the artificial airway. Lavage should be performed with 3 to 10 mL of normal saline, and the number of times a day that lavage is performed should be limited. Disconnect the circuit, instill normal saline, then reconnect the circuit. Turn on the medical vacuum supply and set it to an appropriate intensity. Suctioning can be accomplished with either a single-use disposable suction catheter or a multi-use closed suction system. In this first example, we will use a single-use disposable suction catheter. Choose the smallest possible disposable suction catheter that will effectively mobilize secretions. Connect the chosen suction catheter to the medical vacuum supply. This particular catheter has a side hole for increasing force of suctioning. Disconnect the breathing circuit and advance the suction catheter through the artificial airway. Disconnection may not be necessary if there is a suction port on your breathing circuit. In most cases, advance the suction catheter to the tip of the artificial airway. If there are large amounts of deep secretions present, advance the suction catheter until it touches the carina. Apply negative pressure with the suction catheter by covering the side hole with the thumb, while withdrawing the suction catheter and stabilizing the artificial airway with the other hand. Reconnect the breathing circuit. Another type of single-use disposable suction catheter has no side hole. These suction catheters must be connected to a Yankauer suction tip, which is then connected to the medical vacuum supply. The suction catheter is introduced in the same way, except negative pressure is created by covering the side hole on the Yankauer suction tip. Reconnect the breathing circuit. If the patient is requiring a large fraction of inspired oxygen or a high positive end expiratory pressure, maintenance of same may be a concern. Positive end expiratory pressure can be maintained for as long as possible during disconnection by clamping the tube, using either a needle driver or a plastic clip. Suctioning technique is then the same as described earlier. As always, reconnect the breathing circuit after suctioning. In the next example, the use of a multi-use closed suction system will be demonstrated. If not already attached, prepare and attach the closed suction system. The system is connected between the artificial airway and the breathing circuit. The third end of the closed suction system is connected to the medical vacuum supply. Turn the locking knob on the closed suction system to the open position. Advance the closed suction catheter through the artificial airway into the trachea. Withdraw the suction catheter until the tip is out of the artificial airway and the secretions have been aspirated. Disconnect the medical vacuum supply and return the locking knob to the locked position. Perform follow-up care. Always hyperoxygenate the patient after suctioning. Hyperoxygenation can be accomplished manually or using the ventilator as described earlier in this video. Optionally hyperventilate or hyperinflate the patient's lungs. Hyperventilation and hyperinflation can be accomplished in the same ways as described earlier in this video. Repeat basic hand hygiene as demonstrated at the beginning of this video. Auscultate the patient's lungs for resolution of secretions. Finish by monitoring for complications of the procedure. Complications include desaturations, bradyarrhythmias, coughing, dislodgement of the endotracheal tube, or hemodynamic instability. This instructional video has been produced in association with the Irish Centre for Applied Patient Safety and Simulation. Related training videos for other intensive care procedural skills can be found below. Associated task analyses are available in the research article linked at the beginning of this video.